Hi. One of the questions I get that are asked the most is about careers with psychology is, should I do a master, should I not do a master? I think often students approach me and saying that, well, you're an academic, you probably will recommend that I do a master's, won't you? And more often than not, I strongly recommend against doing a master. And let's just look a little bit at like the different careers you can have and whether you should do a master or you shouldn't do a master. And then we talk a little bit about the details, about the choices and what you have to keep in mind. So I always kind of highlight that there are basically three different paths to psychological careers, right? You can see this here. There are these three kind of different paths. One that is largely centered around mental health. So this could be clinical counseling, educational forensic, and neuropsychologist. Neuropsychologist is something you do after you become one of the before mentioned ones. So let's ignore that for a moment. And let's focus on the first four, okay? So these have all largely to do with mental health. And basically, clinical psychology, counseling psychology, and educational psychology do not need you to do a master's. And for all of these, in general, if you want to do mental health, I do not recommend doing a master's. I think it's a waste of money, it's a waste of time, and you will not get the information or the applications, experience, qualifications that you need to be really competitive to get into one of these fields. Rather, here you should strongly focus on work experience. So, clinical counseling, educational, I would strongly recommend against doing a master's. It's not necessary. All the speakers that come to us and talk about how to become a clinical psychologist and educational psychologist and so forth highlight that you should not do this. Sorry. So rather you should focus on getting work experience. There's one exception, and the exception is forensic psychology. Forensic psychology needs you to do a master's and then the doctorate. So here you can do a master's, and I would recommend doing a master's, okay? But let me kind of shift to the middle page here, which I don't know if that's a great name, called well-being, but here it is all about trying to look at the other paths. And then I will come back and say something about forensic psychology. So organizational psychology, if you want to do something with market research, behavior economics, health psychology, sports psychology, if you want to do basically the first two are the key ones here. The other two are smaller ones. But if you want to do anything in that area, you need to have a master's. So if you want to become an organizational psychologist, you don't do a doctorate, you just do a master's. So you can basically do straight away, if you want to, do a master's after your bachelor, and then you become an organizational psychologist. The same is true if you want to do something that is more related to doing market research, marketing, or something around the topic of behavior economics. Most of the people I talk to recommend that you first get a master's to get that specification or specialization in that area and then move on. But, and this is true for forensic psychology, this is true for organizational psychology, for behavior economics, market research applied focuses, I would strongly recommend that you get at least 1 year of work experience before you're going to do a master's. Because I think we have often illusions about what we want to do. Oh, this sounds great. You know, I would love to work in a human research department. And then you work a year in a human research department and you realize it's not that fun, maybe. It might be really fun. Don't get discouraged. And I think I can't discourage you if you're committed to that career. But I would strongly recommend to get beforehand a year of work experience. It's the same if you want to do research. You should get research experience before you explore a master. Okay, so I think it's like, if I look at all the master students who really excel, who are fantastic, who are doing really well, these are those who come back to do a master, not those who basically did 12 years of school education, then 3 years of bachelor, then 1 year of masters. I think you will face at some point a kind of like an identity crisis, and you should avoid that. So even if you have to do a master's, do at least 1 year of work experience. This will accelerate your growth. This will accelerate the chances that you will get a job massively. Obviously, you can collect a lot of work experience during your degree, but if you haven't, then you should do that. So this is really important to kind of keep in mind. So just to kind of summarize, if you want to do anything with mental health, I strongly recommend against doing a master. If you want to do organizational or behavior economics or market research or something along those lines, then at some point you have to do a master's. But here again, same with forensic psychology. I would stress that you first get a little bit of work experience, see how it is actually to work in these areas. And if you like it, yes, great, go back, and you will have a much more invigorated sense of purpose when you're doing your master's. Don't, and this is something I often experience with students, don't just do a master's because you're not you don't really know what to do. And if you're like, I don't know, maybe I should do a master's, I'm afraid of having a year of like not doing something, I don't know, that looks great on my CV, and that's the reason I want to do a master's. Don't do that. Don't do general masters. Don't do masters that don't have a clear path to a career. No, a master's is this thing that you need for certain careers and for others not, okay? If you do mental health, don't do a master's, okay? This is like, there's no point for you to do that. And if you become a clinical psychologist, an educational or counseling psychologist, you will earn well and you have to pay that money back. And so I would strongly recommend doing a master's in that. I think one student asked me recently and said, like, okay, do I do BPS accredited masters? I want to do something. I want to do a master. Should it be BPS accredited? And I think here the answer is like, it depends a little bit on what you're doing. If you want to do organizational psychology, yes, then you need to have a BPS accredited master's, because that is the master's you need to become a BPS accredited organizational psychologist. So yes, if you want to do forensic psychology, yes, because you need that to become accredited, BPS accredited forensic psychologist. If you want to do clinical counseling or educational, then, and you reject my kind of recommendation, okay, and you say, oh, I still want to do a master's, well, then it doesn't matter, because the BPS doesn't care whether you have a master or not. You can just do whatever you want to do as a master's, because it doesn't qualify you in any way to do these careers. So if you're a clinical psychologist, whether you have a BPS accredited master's or a BPS not accredited master's or no master's, there's no difference, right? So I think it's just, obviously it makes more sense if you want to do a master to do something that is of better quality, and BPS is an indicator of quality, but strictly speaking, it doesn't matter because you don't need those masters. I think health and psychology and health and sports psychology has such niche things that I don't want to talk about here. I also don't know much about that. I had recently a student asking me, he wanted to get into the graduate scheme of the police, and he's like, oh, I'm not sure, I didn't get in this year. Should I do a master to get in next year? I think you shouldn't. I think for all of these things, clinical psychology, counseling, educational, teaching, police, anything like that, what you need is work experience. They want to see if you have that experience, and that's much more important than whether you have a master's or not. Master's is often something where you passively consume content. So sometimes students ask me, but if I do my master, then I get more work experience. Yes, you get more work experience indirectly. So you pay somebody £10,000 so that they can help you to get voluntary work experience. I don't know. I think I would strongly recommend against that and just do it yourself. And I think that's also a stronger signal. We have in a work experience section more about work experience. So just to kind of recap, if you do something with mental health, don't do a master's. If you do organizational behavior economics or forensic psychology, eventually you have to do a master, but make sure that you have enough work experience that you're sure that this is your path, that you're sure that this is what you want to do. If you're not, get work experience. If you want to do anything else that doesn't require a master, civil service, teaching, police officer, or anything like that, don't do a master. Okay? Yes, I think that's it. If you decide to do a master, check out, I think Antonia did a really nice screencast here about basically kind of how to write a CV and a cover letter. I have an extensive guide into how to write really personal statements that are super convincing to get into a master's. I have an amazing ratio of students that I help to apply to master program getting in. I think if you know how to write them, if you think about that, everything I know is in this guide here. So read that guide. here's some things that I started to collect information about interviews. So if you're on job interviews and so forth, then you can use that. But that is very much a work in progress. So I hope this was helpful. If you have any questions related to masters, should I do a master's or should I not do a master's, please drop me an email and I can update this video. Okay? Have a lovely day.